Hi, I'm Dr. Deva Boone from the Southwest Parathyroid Center. This is the Parathyroid Education course, and today we are getting into what is primary hyperparathyroidism. Primary hyperparathyroidism is one of the most common disorders of the parathyroid glands, and it's the most common thing that I treat as a parathyroid surgeon. Primary hyperparathyroidism is typically characterized by high blood calcium levels. That's usually how people get diagnosed with it, is that they have a high blood calcium level and their doctor notices that and then looks into parathyroid disorders because they see the high calcium. It doesn't mean that the patients don't have any other symptoms, but that's often the first thing that leads you to think about parathyroid disease is you see a high blood calcium on your labs. Okay, so high blood calcium, but not every high blood calcium is caused by parathyroid disease. So in order to confirm that it is primary hyperparathyroidism, we need to repeat the labs, this time checking a PTH level with the calcium. So high calcium levels are typically what you see. And then when you check the PTH level, it is usually either in the higher range of normal or high. Note that your parathyroid hormone can be completely normal on your labs, but that still may indicate primary hyperparathyroidism. And the key there is that the parathyroid glands should respond to a high calcium by stopping the production of PTH. So when your calcium's high, the parathyroid glands are supposed to sense that. They're supposed to turn off making the hormone, and you should see a very low level of PTH below the normal range, below 20 picograms per mil. If you don't see that, if you see a, quote, normal range PTH, but your calcium is very high, that's inappropriate. That actually indicates that there is a problem with your parathyroid glands that is causing them to not react appropriately to the calcium. So what does that mean? Well, what's usually happening there? In most cases, this is due to a tumor on one of the parathyroid glands. So I mentioned before, you've got 4 parathyroid glands. They're usually in your neck, right around the thyroid. They're usually tiny, like the size of a grain of rice. But when you have primary hyperparathyroidism, the most common reason for that is a benign tumor on the parathyroid gland. Parathyroid cancers are incredibly rare. So for most patients, you don't even have to think about it. If you have primary hyperparathyroidism, that is almost certainly benign. And it's usually due to a single benign tumor on one of the parathyroid glands. Sometimes you can have tumors on multiple glands. Sometimes all 4 parathyroid glands can actually become overactive and abnormal. But in most cases, especially of primary hyperparathyroidism, there is a single bad or maybe 2 bad parathyroid glands that have little benign tumors on them. And these aren't massive tumors, so you're not going to see it growing out of your neck. The gland is about the size of a grain of rice. The tumor may be the size of a raisin, sometimes a lot bigger, sometimes even smaller than that. So we're not talking about huge tumors here. You can't really feel them. You're not going to be able to see it popping off your neck, but they are causing these problems even if they're very small. It actually doesn't matter how big it gets. You can have a very tiny tumor that produces way too much PTH and makes the calcium too high, and that in itself causes a lot of problems, even if it's some tiny tumor that doesn't show up on any scan because it's too small to. So primary hyperparathyroidism, as I said, typically we're going to see a high calcium level. Now, in the old literature on primary hyperparathyroidism, it will often say that most patients are asymptomatic, meaning it shows up on labs that their calcium's a little bit high, but otherwise they're completely healthy and you would never know anything was wrong. That is not really true. Most patients with primary hyperparathyroidism have symptoms. They do have issues going on, but those issues may not have been attributed to the high calcium, especially if before you know about the high calcium. So let's get into the symptoms a little bit. The most common symptoms of primary hyperparathyroidism are very nonspecific. They're things like fatigue or brain fog, insomnia. These can be quite debilitating. But when you go to your doctor and you say, I'm tired and I have brain fog. There are so many things that it could be due to that parathyroid disease is not the first thing that comes to mind. So your doctor's probably not looking there right away. They're going to check your thyroid function. They're going to check a bunch of labs, and they probably will check a metabolic panel, which will include the calcium. And they may see that the calcium is high, but a lot of times doctors also don't realize that the high calcium can cause symptoms, especially if the calcium is just a little bit high. We know that even when the calcium is just a little bit high, you can get severe symptoms. So a lot of patients who are diagnosed, the doctor will say, well, they don't have any symptoms from this, and their calcium's not bad enough to have symptoms. Well, that's not really true. Any high calcium level can cause problems, and most patients do have symptoms of it, especially if they let the calcium level go. If you ignore it for a few years, you tend to develop more symptoms and worse symptoms with time. So most people who come to me, most of them know they have a high calcium already, and they've likely been diagnosed already, and most of them will have symptoms. Their doctors may not have attributed those symptoms to them because they might be really nonspecific, but most patients are going to have those. And the good thing is that fixing the problem, removing that parathyroid tumor, will fix a lot of those symptoms. So a lot of people will feel better, feel less fatigue, they will sleep better at night, the brain fog clears up. Most patients are going to have some benefit in those areas once the problem is fixed and their calcium levels and PTH levels are back to normal. So, overview of primary hyperparathyroidism. It's characterized in most cases by high calcium levels. And remember, for adults, that would typically be a calcium level that's above 10.0 milligrams per deciliter or 2.50 millimoles per liter. So they have a calcium level above that. They have a PTH level that's either in the high range or in the lab's normal range, but inappropriate. So normal is typically about 20 to 65 picograms per mil. If you've got a PTH level of 50, that's technically normal, but it's not normal if your calcium is high. It's inappropriate. And I encourage you to think about the PTH number as being either appropriate or inappropriate rather than normal range or, abnormal range, because a normal range PTH may be a very abnormal situation if your calcium is not in normal range. The normal PTH is truly normal only if the calcium is also normal. So have this condition, most people will get symptoms. Now, not all the symptoms are nonspecific. So as you let this go, we see higher rates of other issues. Things get even more complicated. So things like cardiac arrhythmias, high blood pressure, calcium actually increases the stiffness of your arteries, which then causes high blood pressure, and especially blood pressure that can be hard to control. So you may have had high blood pressure that was controlled for years, and now suddenly you're on 3 medications and it's still going out of control and you can't figure out why. That could be your high calcium level doing that. You can get kidney stones because now your kidneys have to process all this calcium, and they have so much calcium going through them that it starts to crystallize, form crystals, and then form stones. It can also just damage your kidneys and cause chronic kidney disease, even if you don't get stones, which if left untreated could end in end-stage renal disease. It contributes to blood clotting. So remember, I mentioned calcium is a clotting factor, so it can increase risks there. People get heartburn. They get constipation because it slows down the GI tract. So, heartburn is sort of when your gastric contents are coming back up. It can be quite painful. It can lead to inflammation of the esophagus. All of these things can happen as a result of high calcium. So it's not just feeling tired, it could also be affecting your heart and your kidneys, and you really don't want to let that happen. So parathyroid disease, as I said, usually it's discovered because somebody has a high calcium, but they may also have a bunch of health effects from it that weren't initially attributed to it. So if they started to develop kidney stones and their blood pressure started to rise, likely that's related to their parathyroid disease, even if it wasn't initially realized to be part of it. And because PTH, remember one of the roles for PTH is to take calcium out of your bones, people with parathyroid disease or primary hyperparathyroidism get bone loss and osteoporosis, and it can get quite severe if you let it go untreated. So for all of these reasons, we do want to treat primary hyperparathyroidism, and we'll get into that later, but I already hinted at it. These are due to parathyroid tumors, and the treatment really involves removing that tumor. We'll get into that later.